Hi, I'm Michelle Delo, Director of Nursing. Welcome to Neighborhood. I was actually going to be an accountant, and I was working a job, and it was at a medical office. It was actually my old primary care office, and there was a nurse there, and she was amazing. And I'm like, I don't want to be an accountant anymore. I want to do what she does every single day. And she mentored me, and I started as a medical assistant and just kind of worked my way up. And now I'm the director of nursing here at Neighborhood. I've been a nurse for over 22 years. I've worked in hospitals, off-site settings like Neighborhood, always wanting to work in an underserved community. I am a mom of an autistic son. I have 2 stepchildren. I love to golf, and I actually love being a nurse, always have been, and enjoy just being with my patients, but also all the nurses that do this job every single day. It's what gets me up in the morning. If you were just to walk and listen in here, you can hear nurses on a phone call grabbing that triage, right? Helping that patient. There was a time one of the nurses was talking to a patient that was going through a really difficult time. To see her compassion and stay on that phone, myself going to see if Dr. Delo was there, like us all working together and trying to get the needs of that patient, that's impactful, right? Or you walk through and you see that there's, kids trying to get to their peds appointment, they don't want to go, right? And you just kind of help walk them. Those are impactful, right? Those are moments that, remind me of like, this is why I became a nurse, right? But there was one time that a child hadn't been to the doctor since before COVID, a child with special needs that really is afraid to come to the doctors. And myself, the office man, or the practice administrator, the MA, we all worked together and figured out how we were going to get the patient in a room so it was less stressful, and we did it all. And the mom had tears in her eyes because she finally saw, and she got shots, right? She got her vaccinations. So to me, that was one thing that we all did together that I'll never forget. But every day, I think when you walk these halls, it's impactful, right? Because every single person is doing what they can do for the patient. We have such a great team of nurses here that really, and medical assistants, the whole team actually. Nobody, everybody who works here wants to be here, right? They want to do that. And it's just a great place to be in the same element that you want to be in. And I mean, that's still that feeling. And when you can leave work and still have that feeling, after 22 years, you're in the right field, right?